Mental health screening tool is a way in which we check for the need to do something about mental health problems that we are concerned about. So an example, the most concerning example that we deal with currently are depression screenings and suicide risk screening tools. The reason is that we don't often know, unless we specifically ask the question, that a young person is struggling with depression and or concerned and thinking about the possibility of suicide. So the awareness of the need to link mental health services and primary care has been growing, and the American Academy of Pediatrics, and particularly the Ohio Academy of Pediatrics, have been doing a lot of work to help educate existing pediatricians and providers, and also to help promote the training of pediatricians that as we begin our practices or develop or update our practices, it needs to include an awareness of the need to screen for mental health concerns and be sure that we're making appropriate referrals. There is a program that the Ohio Academy of Pediatrics has done called Building Mental Wellness that I think is a great example of how we as pediatricians are working to understand this increasing concern for our youth and take proactive steps to know when there is a problem and to help connect students and their families directly into the care that they need. So it is an evolving process. The whole integration of primary care and mental health is right at its center right now in this country. So a mental health screening should be used to alert a provider that there is a concern and steps need to be taken, or that there is no concern and that that child is safe and doesn't need any extra or additional steps taken. So a screening tool is just that. It helps us to focus the care that we're providing every day for children to where it needs to be, because we have so many concerns for students. We have to deal with their level of physical activity and their development and their immunizations. There are just so many pieces of ensuring that children stay healthy, develop healthy, and achieve academic success and success in life, that the screening tools help us to identify places where we need to stop and focus on mental health concerns. Well, I think a couple of things. It has to start with conversations with the families and with the community, and some education on what kinds of screening tools are best. The next step, if it's a population-wide screening, is we have to make sure that the resources needed are in place. So, for example, if we were going to do a depression screening in a population of several hundred students, there would need to be a lot of planning to ensure that we had all the resources in place to respond to every identified student's need. And the other part that I think is one of the great opportunities is that we can talk about how we would take the needs that we find in the whole population and maybe develop some interventions that would do prevention work And one of the things that we know is that there are a lot of social pressures on families. And so looking for the other things that are creating stressors that are causing the pressure on mental health systems and also on us as populations would be great. The other thing I think that's really important to think about is to see this as a chance to go from just identifying a problem to creating interventions and, at the end of the day, prevention, because that's what public health is all about. As far as looking into costs and the possibilities of doing population-based screening, we've done a lot of discussing that issue in Cincinnati, and one of the greatest concerns was being sure that we had the plan in place to be able to respond to the number of positive responses that we received. The other is, can you use an electronic tool? Obviously, that becomes a little easier in terms of having all the data come together. And so there are multiple steps in the process. There are cost considerations, there are workforce considerations, there are scheduling considerations, and there is the whole issue of being sure that you're prepared. And I think that's the bottom line. When you do a screening tool that includes risk for depression, you've got to be prepared then to have a full response that identifies and can be sure that every single student that identifies a concern gets prompt access to the mental health services they need to ensure their safety. So as far as screening tools that schools might use, I think there are a lot of considerations. One is being prepared for the responses that you get. So that's one piece of it. The other is what type of tool do you want? The Columbia screening is the one that we have selected to use in Cincinnati between the schools, the mental health providers, and the primary care providers. And that's because we wanted a common tool that would translate easily across all types of providers. The Centers for Disease Control has an anonymous electronic process that they use called the Youth Behavioral Risk Survey, which is a great tool. And I'm not sure how many schools actually use that tool, which is offered up as far as schools can sign up to participate in that. So that would be an example. So I don't know that we have a really good tool that identifies and can answer the question about the number of screenings that are going on in the schools. I will say a couple of things, specifically talking about Cincinnati Public Schools because of our strong partnerships. And that is that, one, there are 25 school-based health centers in the 55 schools in Cincinnati Public, and those providers for the children ages 12 and above are doing mental health screenings, the depression screenings related to the concerns, and also the expert screenings that are asking the questions about drug and alcohol. So I know those are in place inside the school-based health centers. The other is that we have mental health providers located in every school in Cincinnati Public. So any child that there is a concern that goes to the mental health provider there, they are being screened to determine if there are any risks. And then there are emergency plans in place that the district has established that are monitoring as well and providing support. So there are those multiple sort of across the system pieces. Then individual schools have done some programming themselves because of concerns that the particular school has. And when we do that, we really work to make sure, and that's the thing I think I have to come back and emphasize, is anytime you're doing a screening, that we have to be sure that the resources for access to support are available for the students that need it. So we have to know that we can fully respond, and that's, to me, the most important piece. One of the things I think it's important to really emphasize is when we are planning a screening, a part of the planning process has to be being sure that we can answer every single child that is identified at risk. We have to be able to respond immediately to their concerns based on how high risk. If they're saying things that make us be concerned that they're thinking about suicide, we have to respond that day. We have to have the resources in place to make sure that that child that's now been identified and shared with someone what they're thinking about gets the help that they need that day.